So Inuktitut is one of the Aboriginal languages in Canada which are not under great threat of extinction, and that's great. We have 25 communities. They're only accessible by air or by sea. There are no roads connecting any community to any other one. So, moving from that overview of Nunavut, and by the way, we have health centers in each one of our communities. The health centers are populated by nurses and community health representatives, administrative workers. So there is access to primary medical care in every one of our communities. It's not like some First Nations communities I've worked with that have only a CHR and a nurse comes once or twice a week. So women do have access to ongoing care. And physicians are also hired in Nunavut, and they visit communities on a regular basis, but they're not in each community all the time. I think that's important to recognize with the initial comments of lack of accessibility to primary care services. I think Nunavut is doing a reasonable job in making sure that we do have those services available in each and every one of our communities. So with respect to HPV, and this, I think an opening comment on the whole issue of HPV is how astonishing it was for the medical community to learn that there was a virus linked to cancer. I mean, this was unheard of. When I went to medical school, if you had said, by the way, they're going to come out with some research that shows that if you get a viral infection, it leads to cancer, people would have been flabbergasted. I mean, that was one of the remarkable new paradigms in medicine. So now we know HPV, human papillomavirus infection, is associated with cervical cancer. In Nunavut, cervical cancer incidence is the number of new cases, or the rate of new cases, decreased in between 94 and 2000. I think it speaks well of the Nunavut system. We don't have a population-based screening system for pap smears, for cervical cancer screening, but we have a pretty good uptake compared with some areas of the country and some jurisdictions. This was the last rate I could find was in 2005, and I don't know whether there could be under-reporting. I don't think there'd be over-reporting, but it gave me a sense of comfort that we're not grossly under-testing women. And women would get tested. Most nurses test women anytime they come in for their first prenatal visit. And they should also be tested on a regular basis according to the latest guidelines for when one initiates screening and how one continues it. And I've just had a discussion with Dr. Trina Green of our acute care team with respect to possible new guidelines that are being considered. So there was a study done by Sylvia Healy, who used to work for the government of Nunavut, and she found a 26% prevalence of high-risk HPV and a 6% prevalence of significant pathology findings or test findings in terms of bad cells in the cervix. I don't know if that's the most technical term I could use, but and we wondered. Now I see the next thing in here. I probably put that in the wrong place, but the whole purpose of doing our surveillance was to look into the use of something called Gardasil. Everybody know that name? The drug companies are getting really into marketing vaccines nowadays. It seems like the newest profit-making center for them. So the federal government announced a few years ago a $300 million pot of money that would be given to all the provinces and territories, divided up, so they could buy this product and initiate human papillomavirus immunization programs, publicly funded programs. And at the time that they announced this, I thought we would want to have some evidence that actually the types of the HPV virus, there are many, many types of them, some of them more associated with cancer, cervical cancer. I wasn't sure, as a result of Sylvia Healy's work, if those types were as common in Nunavut as they were in the rest of the country, and it didn't make sense to spend hundreds of thousands of dollars on a vaccine if it didn't actually prevent the acquisition of the types of HPV which were infecting women in Nunavut. So we wanted to provide evidence for this decision about introducing the vaccine. And we also shared an objective with the Public Health Agency to contribute to the national baseline prevalence of HPV. And we wanted to, oh, I see, baseline prevalence of HPV prevalence. I'm sorry about that. And we were looking also at differences in prevalence in Inuit and non-Inuit women. Because our population is 85% Inuit, we don't always differentiate between Inuit and non-Inuit in our own statistics. Well, we did in this case. So we do routine Pap testing at all the centers, as I mentioned, and between January 2008 and March of 2009, every Pap smear, which is done using something called liquid-based cytology, and it's actually done for us in Edmonton. This is where we send all of our lab samples. And somebody asked me the other day, why do you send things to Edmonton? I don't know. That's the agreement that we have. The provincial lab does that for us. But with the Public Health Agency's cooperation, all of those samples that were leftover bits of the sampling that could be sent to the National Microbiology Lab for HPV typing. This is not generally done. Does any jurisdiction do that now on a regular basis? No. So this is really in the forefront of this type of work. It may become more common in the future. There was a cancer screening symposium in Toronto a few years ago, and there was a gentleman there who was an expert in cervical cancer and cervical cancer screening, saying that in the future, Pap smears and HPV typing might be always linked. So this may be the wave of the future. Now, are some of you here lab-type people who would like to hear more about how the testing was done at the National Microbiology Lab? Because I've got some information from Alberto Severini if you'd like. No? You're okay if I don't tell you the specific details? Stephanie, would Alberto be upset if I don't?
We won't tell him.
You won't tell, okay. And these were non-nominal results. So we were doing this to see the prevalence of these infections. It wasn't linked to people's names. We weren't going back and telling them the results of their HPV tests. So the analysis revealed the prevalence of HPV types and the Pap results in all the Nunavut women who were tested in that time period. We compared age-standardized rates for Inuit and non-Aboriginal women. We have very few First Nations or Métis in Nunavut. And we found an association between high-risk HPV type and high-grade cervical lesions in Inuit women. The high-risk types are listed here, and there are categories. The high-grade lesion includes, I don't know who did this in Bethesda. That's probably some U.S. military hospital that developed these little words. But here are the results. And I should say that we have high rates of sexually transmitted infections in Nunavut. HPV is a sexually transmitted infection, and so to find rates that are not extremely low is not that surprising, because the last report we put out indicated that we had 17 times the national rate of chlamydia. We have rising rates of gonorrhea. As a result, we've hired someone full-time now to work on a sexual health strategy for Nunavut. We recognize that this is a really challenging area and very important. So HPV results, any type of HPV. Now HPV can infect women with intercourse, so women can become infected. One interesting thing about HPV infection, though, is many young women get an infection and they clear it on their own. So it doesn't mean that once you're infected, you're always going to have this virus in your system. You can have an infection which will go away. On the other hand, you can get an infection which can lead to the progression of cervical cancer. So the fact that this number of women is infected doesn't mean that they are all necessarily at risk for cervical cancer in the future. So you see the results there. And there is a significant amount of high-risk HPV types in the population, and a significant amount also of multiple high-risk types. That means a woman infected with more than one of the high-risk types. And this is the list. So basically, when we looked at this for evidence-based decision-making with the vaccine covers the oncogenic types HPV 16 and HPV 18 are two of the types. What else does it cover? What? 6 and 11, okay. So we really wanted to know, do we have women infected with 16 and 18, which Gardasil can protect against? And you see that we do have 6.4% infection with type 16, and 18 is on the list, although a surprising result was that this type 31 was quite prevalent, and that's not found in other studies to date. And these are the results of the pap smears. And as you go from the bottom, at the top to the bottom, it's progressively more problematic, you know, where the cells suggest progression to cancer. So, I mean, the good news is most of them are benign negative, but you do see there are some cells being identified which could become cancer. Okay. And here's the comparison of Inuit and non-Inuit women. So the striking difference here is that of the women who were tested, that you'll see that Inuit in the 10 to 19 range are quite well represented, and non-Inuit are not. And as the ages get older, it looks as if there's a balancing out of those communities infected. This is not easy to read, but if any of you need this information afterwards, we'll be happy to give you a hard copy. So this is just basically showing you that these types of HPV are associated with abnormal PAPs. So sorry, I'm trying to go back. I don't know if I've missed. I have a slide here on my on the desk which I can't find. Oh my! Not doing well here. Forget the slides. I'll just finish the talk. It looks like this pointer has totally destroyed my continuity here. Okay. So with HPV 16, the odds of having a high-grade lesion, if you were infected with HPV 16, was 47.3%. That's pretty significant rates. And with 18, it was 8.1%. So certainly the introduction of Gardasil in Nunavut is going to be very helpful to prevent future cases of cervical cancer. Mind you, we have to continue with our pap smear testing because the cohort that's getting the vaccine now are girls in grade 6 who are ages 9 or over. So that means the benefit of this vaccine is going to be seen many years into the future. But it's a great public health intervention. So the summary is gone. So we have high rates of HPV infection in Nunavut. Inuit women have higher rates of some, but not all, HPV types, and they have a higher rate overall of HPV than exists in non-Aboriginal women. This is particularly true in younger age groups, as you saw. But the rates of high-grade cervical lesions are not significantly different between the groups, Inuit and non-Inuit. And finally, that finding that the prevalence of HPV 31 is higher than studies done in other parts of Canada, but we're not sure of its significance to the development of cervical cancer. So we don't know why we have higher HPV rates in Inuit women. This requires further investigation, and we hope that further surveillance will increase the statistical power to examine the risk of high-grade lesions due to HPV infection in Inuit women. We want to especially thank the participation of the women of Nunavut in this important surveillance initiative, and thank you for your attention.